if you can start a recording. So welcome everybody to this mHealth talk, this summer mHealth talk, and happy to have so many representatives from so many different places in Europe and from elsewhere. So today, I'm just first presenting myself. I'm Luc Nicolas, I'm working for Etel, and within the mHealth Hub, my role and the Etel's role is more to support the partnership work stream, which is to try to identify the key possible partners for the mHealth Hub in the future. And today we are very happy to welcome ORCHA and a number of speakers coming from different member states who have been working with ORCHA in developing specific initiatives. So just a few tips before coming. We are using today the webinar function for Teams. So that means that you are not allowed to speak or to activate your camera, but if need be, or if you have a specific question, you will be authorized to speak. We will provide you the right to do so. But if you have any question, please use the chat. Just use the chat, which is open and transparent for everybody. We will monitor this all the time and make sure your questions are answered. So please try to ask the questions first in the chat. That it is. So without wasting more time, I will now leave the floor to Hani. This Hani who's working for ITU and is the senior coordinator of the digital services within ITU, and who has been playing a key role in the mHealth Hub. So, Hani, the floor is yours.
Thank you very much, Luc, and good morning, good afternoon, everyone. Please let me know if for any reason you cannot hear me well or you don't see my screen. Anyway, I'll have the pleasure to give you a little bit of introduction about the mHealth Hub for those who didn't have the opportunity to learn a little bit about it and what the Hub is doing, who are the members of the Hub, and I'm going to try to focus on a couple of points that are relevant for our discussion today, particularly when it comes to the assessment frameworks and providing country support. So the Hub actually is a joint effort between three main partners: the ITU, the International Telecommunication Union, the WHO, and the Andalusia Regional Ministry of Health of Spain, working with 17 members of a consortium. And this consortium is really very wide in terms of scope and diversification. There are members that are coming from governments, members representing some healthcare systems, tech sector, NGO, academia. So the Hub really benefits from a wide variety of expertise, also regional representation from different parts of Europe, with one main focused objective is really to provide a platform for knowledge sharing and to foster innovations, particularly when it comes to mobile health innovations, and really work together to scale up and mainstream mobile health in different health systems and integrate those mHealth innovations in health systems. You have the website, which is also provided here for you to get a little bit more information. In terms of the Hub products, what the Hub is really producing, there is a variety of tools that are currently available or under development. Some of them which we call knowledge tools, and some of them are very relevant for this discussion. So the first one is really a number of knowledge products that we have developed when it comes to mHealth assessment frameworks. It's really assist the decision makers whether in creating a completely new mHealth assessment framework, or maybe adopting an existing one, or maybe even improving an existing mHealth assessment framework, leveraging the experiences and learning from so many different initiatives and experiences in developing similar types of frameworks. So that's our first knowledge tool, and I'm going to shed a little bit more light in a few minutes about this particular tool. Another important tool, which is disease specific, is really to try to take one particular disease, which is in this case is diabetes, and really try to, again, compile the knowledge and experiences from so many different countries across the globe and try to provide some guidance on how you scale up and integrate in health systems a very specific disease-specific innovations around diabetes, and how can you scale it up, and what are the continuum of care that those types of innovations can cover, and how would you deal with that, and how you build up, those types of innovations. A third knowledge tool is really about how any of those tools kind of be mainstreamed and integrated into the health systems. And this covers a wide variety of topics and issues that are extremely relevant when it comes to scaling up mHealth. And it's really based on a large number of case studies that we have developed, that we have documented, really to be able to, share, the most relevant lessons learned, so you don't have to do the same mistakes, and you can start from where the other ended. Another important contribution that the Hub is trying to do is about how you develop policy frameworks for mHealth. And here again, we have developed some, guidance about a number of important policy areas when it comes, for example, to mHealth strategies, governance and change management, policies around interoperability, how you manage innovation funds, how you have policies about reimbursement, how you develop policies about privacy and data security, how you measure and kind of push impact of innovation, and last but not least, of course, how you prioritize health innovations in time of emergencies, particularly given the last kind of COVID situation. So again, those type of policy framework provide a lot of good guidance and a lot of examples actually from what countries has developed in terms of policy frameworks that can help them again to scale up the mHealth. The mHealth also hub is providing a number of services that can support member states, when it comes to, learning about certain initiatives. So we are developing catalogs of initiatives, and I'm going to mention a few of those in a minute, but also, providing some expertise and when it comes to country support, and also a platform for knowledge sharing and networking. And last, also but not least, is also we have developed a quick guide for mHealth ethics, which is extremely important, and it's really becoming more and more a relevant topic for many countries. So those are the current Hub products, but the Hub will continue to develop additional knowledge tools as such. But more importantly is not only to develop the knowledge tool, but also to work with countries in adopting and adapting those types of knowledge tools to their own contexts. When it comes to zoom in on one particular knowledge tool, which is about the health apps assessment frameworks. So this is our knowledge tool, which we call number one. Is really to assist decision makers whether they would like to develop a new assessment framework or adopting an existing assessment framework, but also explore and identify possibilities for commonalities across assessment frameworks, with the aim of saying what are the minimum common denominator, what are the minimum common assessment criteria that could be potentially used for cross recognition and mutual recognition across different countries in the European region. The approach that the Hub adopted is to say, let's first of all identify and analyze what existed already in terms of assessment framework. So we looked at 24 existing assessment framework that are mature and developed to different extent. We have extracted, the domains and criteria, so the kind of assessment domains and criteria that were used and identified by those assessment framework. And we have provided some analysis to try to kind of identify them, describe them. and then provide some guidance on for countries to see how they can adopt those types of assessment frameworks. And then we have done some validation with the assessment frameworks owners. And then lastly, we have put all of that in some sort of publications and reports and some tools which I'm sharing now on the screen. We have like a kind of a full report on that describes all what I said, but also we have put an easy access to all those assessment frameworks, so countries can go very easily to kind of go to the assessment frameworks and look how they have been developed and used. And then lastly, we have also made a repository of repositories of mHealth apps. So we try to collect across number of European countries like Belgium, Denmark, France, Germany, etc. If they have developed some sort of an mHealth apps repository, which assumes that this repository has applied some sort of evaluation and assessment criteria before including any app in their own repository. So this is a repository of repositories. So it gives a kind of a very easy access to all, the kind of experience that exists across Europe when it comes to, creating some sort of a certified place where citizens can access with some level of confidence and assurance about the quality of the mHealth apps. Those are some of the features of this knowledge tool about assessment frameworks, is really to try to provide some key steps. How do you go about building an assessment framework? What are the consideration and examples that you can leverage while doing that? And then focusing on 25 particular aspects that are relevant when it comes to including them in your assessment framework, and then also analyzing those types of aspects and try to identify what are the commonalities that seems to be very repetitive and seems to be very common across all those assessment frameworks, and this could be a potential for kind of a basis for mutual recognition across different countries within the region. I'm not going into details, but just to give you a very kind of a quick feeling about how those tools look like. This is, for example, like a kind of a stepwise approach in terms of developing an assessment framework, from starting to define your scope, types of apps, how to involve experts, how you kind of identify your assessment domains and criteria, etc., etc. And while doing this, you don't need, of course, to do this from scratch. You can look at previous experiences, examples from what has happened in other countries. And I think what we're going to see today as a very concrete example from ORCHA, how can you go through this process in a very, very accelerated manner, in a way that you don't need to, between quotes, reinvent the wheel each time. But those types of documentation or knowledge tools that we have created would help countries to really making sure that they are kind of, going step by step, and they are not missing an important step, and they have some confidence about the decisions and selections or choices that are making in the process. I mentioned that we have identified 25 aspects that are extremely important to be considered, and this is just a list of those 25 different aspects that seem to be very common across the all frameworks, and it's really about looking at those and say, how can we enrich my existing assessment framework, or help me really to consider to make me the easy choices to see what do I need to look at when I'm assessing an mHealth app and trying to create some certification or include it in a kind of an app store or app repository. When we looked at and compared those,
just to let you know that we need to speed up.
Yes, sure.
You should try to conclude here.
Okay, very good, thank you. When we consider comparing the assessment frameworks, we kind of identified some elements that are very common, and this is just the list without going into details, but it gives you a kind of a good sense on on what are the most common criteria across different frameworks. Maybe last point I would like to do is also about the type of support that the hub is providing to countries. I'll give two quick examples about Hungary and Czech Republic. Those countries are in a very different stages of development, and the context is very different. For Hungary, the hub was working to kind of assist in implementing and scaling up an M-diabetes solution for health workers and patients, and engaged with the countries to organize multidisciplinary meetings and adopting a persona approach, and really trying to co-create some sort of an M-diabetes interventions that could scale up. And then in the Czech Republic, which is a slightly different context, we helped the hub, helped the Ministry of Health to build up a kind of an funding and reimbursement models, and really try to put in place an e-health program and to get access of funds from the recovery fund, and really try to use different tools for health promotion. So this is in a nutshell a very quick overview about the hub. Of course, if you have any question, we'll be very glad to kind of respond to your questions. Thank you very much, and over to you.
Thank you very much, Hani, for this to the point presentation. So without wasting any time, I will now give the floor to Tim Andrews, who has been leading the destiny of ORCHA since the very beginning, Tim, I think, as your co-founder, and you're also the Chief Operating Officer of ORCHA, who has now quite a number of years of experience in developing support, when assessing solutions, and then more and more also providing support to member states. So that's what you're going to focus upon today. So trying to explain us what is the specificity of ORCHA, and then we'll dig into 3 different kinds of supports with 3 presentations. Right? So the floor is yours, Tim.
Thank you, Luke, and hello everybody. I'm just going to share my slides. Hopefully that's you can see that. So yes, I'm just hang on, it's whirring. There we go. Yeah, so what I was just going to run through, and I'm just conscious of time, so make sure I don't waffle on too long, is really just a little bit of a sort of backdrop, although I suspect most of you on sort of tuning in, so to speak, will be fully aware of a lot of this. There are a lot of products. That's one of the things about the digital health landscape, and of course the accreditation context there is how do you manage a process where there are so many potential solutions. And what we're seeing is that for some reason those images are not shown, but basically what we're seeing is that whilst there has been a huge uptick in interest in digital health, and that was that sort of interest was always there, to be fair, what that isn't matched with actually on the ground often is quite the rate of adoption and use that everybody would like to see, particularly in areas where that impact healthcare systems more specifically. So the growth in digital health, and the kind of the public adoption of digital health tends to be in the areas of well-being and kind of the lower level areas. And the opportunity that's perhaps being most missed at the minute is the ability for digital health to be really embedded into healthcare systems. So we've spent a lot of time over the years at ORCHA wondering what it is that sits behind that. What are the main barriers to the adoption and use of digital health? And roughly speaking, we sort of group them into these key areas. So we talk about first of all trust, actually. So on this list I'd put trust first, and that being particularly acute for healthcare systems and healthcare professionals who just are inhibited from properly engaging with these products without knowing that they're safe to engage with. And so trust comes in a number of forms, and the solution to that, which we'll explore in a minute, obviously accreditation has a huge part to play in that. But in addition, on top of that, you've also got to provide the wherewithal for these solutions to be integrated into the way healthcare systems work, and to make it easy for those who operate within healthcare settings to utilize them. So although accessibility perhaps isn't the best way to describe that, I mean, I tend to use the term systematization. You know, is it easy for healthcare professionals to find the products that they ought to be engaging with, and to make those products available to their patients or service users? And I suppose linked to that, of course, is awareness and habit. So whilst that isn't happening, whilst that's not a habitual part or a regular part of your average healthcare professional's day-to-day existence, it won't form a habit, and it won't become something that they're regularly doing. So all of these things are kind of interconnected. And of course, governance finally is probably, you know, heavily related to trust, but it's subtly different. And we talk to many of our clients, national, international, or local, about the need to grant permission, particularly in a healthcare setting, and to be very specific about the fact that you are saying to people within that system, you can use these products. And therefore governance is a little bit more than just, you know, trusting the product. It's also giving permission to those, you know, those involved in it. So what we know is that within that huge array of digital health products, there are, you know, frankly, a lot that don't meet very many of the regulatory requirements, you know, even the minimum regulatory requirements that apply to this sector. But on the face of it, you know, using your traditional channels of, you know, the App Store or Google Play, or just the web, you know, web searches, how would you know? So that's where accreditation really stands as in, you know, is key. So the trust issue, you know, really, and the governance issue, which is what I'll really focus on here, really come to, you know, the heart of this. And absolutely critical to that is providing an accreditation process. And by accreditation, you could, you know, that basically for us means some sort of endorsement, essentially. So although standards are great, standards on their own are not quite the same as accreditation, and for us there's a difference. So applying a standard is useful, and knowing a product meets a standard is useful, but that's not quite the same, as I say, as being given permission. And accreditation regimes typically are moving you to that next level, which we think is absolutely crucial in this context. So then, you know, as was already mentioned, what should the accreditation processes look like, and what we have emerging is a growing consensus, I think, around the key areas that should be thought, you know, that you need to look at. And actually, it's one of the key challenges in digital health, that there is a very broad spectrum of things that, you know, your digital health products sort of invite scrutiny on. So obvious things, you know, that everybody pretty much agrees with, although there are some emerging differences, are around data and privacy. Security has also become something that's, again, more and more broadly accepted as being something that needs to be looked into. Clinical assurance and user experience are typically to be found in virtually all of those, in most of the assessment frameworks that Luke was referring to earlier, and Tino was referring to earlier. But this is where probably the main differences start to occur across different frameworks. And so obviously in what we term clinical assurance, you have things like medical device regulation, but you also have clinical safety or clinical risk standards, evidential requirements and the like, and that can be very different, and there are, you know, a number of emerging approaches to that are quite distinct. And yet on the user experience side, which includes things like usability and accessibility, this is an area where perhaps all of the frameworks are the weakest, because there isn't really a good solid database of reliable user experience information. So although the usability and accessibility components can be evaluated, and they're becoming more sophisticated, actually getting proper user experience feedback is really, really tricky. So unfortunately these slides are not, for me at least, are not showing the information. So I shall ad lib. So what we've started to do here is identify in ORCHA the various different assessment frameworks, similar to what the mHealth Hub have done, and we've started to kind of build into our systems the ability to deliver against each of those different assessment frameworks. So the bit that you can't see on there, you can see the NICE ESF and medical device regulations, but the things that probably I would be referencing here more specifically are things like the the NHSX DTAC standard, which is the new standard that's been published in the UK, and is essentially mandated as being the kind of compliance level a product needs to reach in order to get into an NHS setting in a formal way. Then other frameworks of note, and what's really exciting and rapidly on its way to us soon is the new ISO standard, ISO 82304. And again, that's been a huge amount of work from the team there to sort of probably to an extent do some of that synthesis of those different assessment frameworks, but also build in new areas of assessment into that standard as well. And that's going to become, I think, a really interesting and important kind of new baseline, actually, possibly. And certainly probably in the European context, I can see that gaining significant traction as being the new kind of sort of baseline, as I say, for different for digital health assessments in different contexts. Then you have assessment frameworks like the DIGA assessment in Germany, which is looking at the higher end product sets there, looking at medical devices, software as medical devices, and applying it again a very specific and focused assessment in relation to those rather than the more broad assessment that the NHS DTAC and the ISO standards sort of look to cover. And then on top of that, you now have these emerging kind of national kind of approaches, which we're going to hear about down the line. And I'm going to touch on one in Israel that we've worked on, but there's also work going on in New Zealand, in the US, in Canada, in the Nordics, which Anders is going to take us through, and in Holland. And all of these frameworks have got their own national kind of sort of flavour, but there is a huge degree of consensus across them as well. One of the things that we do, through all of this is we try to identify as much as possible where that consensus point lies, and we have what's called the ORCHA baseline review. So what we do is every product that we ever look at always goes through the ORCHA baseline review first, and that includes currently about 350 different questions across 3 primary assessment domains. So all of those domains that I referred to earlier, apart from security and technical stability, are in the ORCHA baseline review, and that picks up a huge amount of the kind of the core information, the core inquiries that you'd expect to see and that you do see in all of these different emerging frameworks. And the way that process works is also designed to meet some of the unique challenges that digital health accreditation poses to us. So one of the things is keeping on top of these products. They change very rapidly. New ones come on the market, different ones drop away. So having a weekly kind of what we call a scrape, so basically going and finding all those products and then auto assessing them for changes and updates, etc., is really important in order to keep on top of everything that you've already assessed. Because once we've assessed something, it has to remain, each version of it then has to be reassessed to ensure that it remains compliant with, or with the standards that we're checking out. So we do that in an automated way, pulling in lots of different data to sort of evaluate and monitor those different products. We then have the whole process. This baseline review is built into a very structured system, which we call a review engine, and that's used to support make that process really efficient, because we don't have to answer 350 questions for every product. products have hugely varying features and functions. Some of them are a lot simpler, some of them are very complex, and therefore the review engine allows us to build a dynamically tailored assessments that respond to the complexity and the unique characteristics of each product, and ensures that we only look at the things that we need to look at for for a product, and that makes the process much more efficient. And we then also, of course, engage as much as possible with the product owners or the developers to ensure that they have the opportunity to validate what we found before that is published in multiple different guises, which I'll come back to. So this slide, I knew this slide was not going to tell you very much because it's missing all the crucial ticks and crosses. But what it's essentially trying to show you is across all of those different frameworks, as represented in the vertical columns, we have this on the left-hand side, this sort of growing consensus about what we should be looking at in a digital health context. So in the ORCHA baseline review, pretty much what you would see if the slides were not being difficult would be ticks across all of that, across all of those different assessment frameworks. So pretty much aspects of clinical assurance in the ORCHA baseline review are pretty much adopted universally across all of those different frameworks. The usability and accessibility assessments in that baseline are accepted, and the data and privacy approach is broadly accepted. What then happens is the layer above that, which we call the enhanced review layer, offers a sort of menu of options for different assessment frameworks to choose, and different organisations and accrediting bodies to choose from. And so what you would see there is a more mixed picture of which of these frameworks have adopted which of these different kind of enhanced review components. But what is emerging, however, is still not 100% consensus, but in a way, there are usually at least 3 or 4 frameworks that are adopting one of these enhanced review components. And so one of the advantages of the system that ORCHA's built is that because that the data relates to a product, that can be shared across multiple frameworks. So if it happens to be that the assessment's been done for the Nordic baseline review, which Anders will refer to later, if that same information is required for the Israeli assessment or the New Zealand assessment with Health Navigator, then that information can be shared, and therefore from the developer's perspective, they don't have to re-import that to go through those assessments. And from obviously the accrediting body's perspective, it's something they don't have to then undertake an assessment against. It's already there, so there's some efficiency gain from that process. So a really interesting slide. It would have a nice picture of some digital health libraries. The important thing here, of course, is that to remember, and I know this is something Anders will probably reference specifically, that we are assessing for a reason, and that reason is to increase that adoption and use. And so if you don't make public the results of that assessment in lots of different ways, then it sort of defeats the purpose of what we're trying to do. So the actual information that you publish about the assessments is almost as important as the assessments themselves. And actually, in the space of digital health, that publication process is quite critical, because there are judgments to be made about whether a product is good or bad. And they can be personal judgments, and some people might feel that a product that shares their data is inappropriate, others have a different view. So actually, rather than striking some hard and fast rules in this regard, you can actually just make that information available, and as long as people are aware of that, they can make their own choices. So some of the publication sort of part of this is actually very critical to the way in which you can build the assessment process itself.
You need to speed up a bit.
Yeah, I was just gonna flick through to the just to summarize the Israeli process. So I'm pretending to be Yale from the Israeli team today to just look at that. So this is an example of a process.
No, Tim.
Yeah.
If you allow, could we come back to the Israeli case after the word?
It's cool.
Thank you very much.
In which case, all I do is just summarize where we ended up with this. Was that there are lots of different frameworks, but what we're seeing is that actually there's a huge amount of consensus emerging across those different frameworks. As I say, I think the new ISO standard really operates as quite a good kind of consolidator of that. And as I say, I imagine that's likely to become something of a new baseline, that more and more organisations will adopt most of those elements going forward. The important thing about it, however, is that you need to be able to balance practicality and rigour, and therefore being able to make the job easier for developers to actually meet all of these different accreditation requirements is critical, because then they'll engage. And also the ability, and as a result of that, what you're able to do is actually push the developers and the product owners towards being more compliant and creating higher standard products. So in summary, I think the key thing for us is that although it appears like quite a complex and diverse world, actually it is increasingly becoming more and more practically convergent on the ground. And I'll probably leave it at that.
Yeah, thank you, Tim. So yes, let's see now how concretely this has been implemented in the first case with, and I'm now happy to welcome Anders Turnholt Hansen from the Nordic Interoperability Project. You are the CEO, sorry, Anders, of this very important project. And I'll leave you the floor immediately.
Thank you. I will also be sharing my slides with you so you can see. Hopefully you're able to see my slide.
Yeah.
Can you just confirm? Yeah.
Perfect.
Perfect. I will give you a very quick insight into why we ended up with working with digital health accreditation. And it all started 3 years ago after a lot of discussions in the 5 Nordic countries about better cooperation, and not to forget the huge potential of sharing health data between or across national borders. And all these discussions ended up with just a lot of more discussions, so nothing much happened between the seminars and the meeting places where this was on the agenda. So a group of people then put their heads together after the HIMSS conference in Spain in 2018 and said, let's do something instead of just talking. And that was the start of this project with a rather complicated name, Nordic Interoperability Project. We use NIP for short to make it easier. But what we were looking at very quickly was that what we wanted to work on was making cross-national border patient and health data mobility into the Nordic reality. So the reason for this, when we started, was that there was a lot of stakeholders that has benefit and saw a lot of potential when it came to the cooperation between countries. And then, of course, the Nordics have a history of working together and have a region that has kind of more or less common grounds, more or less common language, but also we had a common welfare model where we were taken care of by the state, and we are paying quite high taxes for that. So a lot of the push had to be in a cooperation between the public and the private sector. So this is just an example of some of the partners and supporters that we have in the project and a growing group of organizations. The project that I'm leading is highly ambitious. Making cross-border health data mobility the Nordic reality is highly ambitious, but the goal of this project is not defined by us, it's defined by the Nordic Council of Ministers. They decided around the same time as this project started that in 2030, the Nordics should be the most sustainable and integrated health region in the world. And they made a cartoon, a film, showcasing their future patient, Sophia, who was traveling across these 5 countries and had her health data available either for care purposes or for innovation and research purposes. So the only thing we did in this project was to support that decision, saying that we agree with that decision, we just want to see things happening. And to just have a little bit about the background, there's been a lot of reports around this Nordic goal of 2030 being developed, one of them being the Nordic Health 2030 report. There's another one called the Nordic Commons, who is addressing the huge amount of quality data in these existing in different data lakes in these 5 countries, and the benefit and the need of connecting those to be able to utilize this for for personalized medicine or for diagnosis. And then there's also a report on the legal issues of interoperability among these 5 countries and what kind of openings the legislation today gives, but also what has to be changed to make this happen. And in this 2030 report, Nordic Health 2030, it pinpoints that the Nordic welfare model is not sustainable. And one of the reasons for that is because we are focusing very much on healthcare and very little on preventative care. So out of the GDP, we use approximately 11% of GDP on traditional healthcare, or what we could call as sick care, because that's money floating into the system when we have been defined as sick or a patient. But we only spend 0.3 for preventative care. So there has to be a shift focusing more on preventative care. As the report, they're pinpointing to 3 areas we have to focus on. We have to find a new social contract with the individual to make them more involved in their own care. And this is where digital health is coming in as a tool to make that happen. It also pinpoints that we have to find new ways of sharing data and also new business models where we can also then reward preventative care. And in that report, they also have a very balanced model where they have the showcasing how it's meant to be in 2030, where you have the individual on the one side, you have the healthcare system on the other side, and you have the data floating very nicely back and forth between those two. Well, that is the 2030 model, because we all know that in 2021, the individual is more or less not visible in that model. So something has to be done to get the individual more involved. So NIP has then looked into what could we do then as a Nordic project to create enablers for innovation and business development. And one of them, these platforms that we're looking into, is called the Nordic Patient Data Lake. That is about the Nordic Commons report, where we could connect data lakes across these 5 countries. Now, if we succeed doing that, that would be hugely beneficial for the healthcare system, but it would only be combining data from the system. It would not mean anything for the individual and getting the individuals involved. And that's where this other project and platform is coming in, the Nordic Digital Health and Medication Platform. And that's where I'm going to have the focus, because that is the accreditation platform for digital health solutions, but also the activation platform for digital health solutions. And as you can see, comparing this to the model above, even though digital health could definitely be part of the healthcare care system, it would also enable the individuals to be more involved in their own care, either for preventative care purposes or for healthcare purposes. So what we wanted to do with this was to regulate what is an unregulated market in the Nordics, and we also wanted to build a one Nordic home market for the industry. So both to benefit the healthcare sector, but also to stimulate the healthcare industry to build digital health solutions that could be viable and sustainable also business-wise. And in that work, we found that ORCHA and NHS had already done this for several years. So when we started looking at this, we knew that all the 5 countries wanted to do something about this, but none of them had actually started. So based on the 2030 perspective, we found that it was better for these 5 countries to start cooperating in 2021 than to start to make 5 different frameworks for digital health accreditation and then try to merge them together in this integrated health perspective in 2030. So we took the initiative to then start building a Nordic framework and found that ORCHA had already done a lot of work for us that we could benefit from. And in this whole essence of this is that it's really important when starting looking at these kind of frameworks that the unlocking the power of digital health is not about finding out the right standard and on how to do the accreditation. It's more about finding a system where you also focus on the implementation and activation of digital health, because we don't need a lot of quality assured digital health solutions. We need a lot of quality assured digital health solutions in the right hands and the hands of the healthcare workers and of the individuals. So this is the kind of the setup of the project that we're currently doing, started in 2020 with the support from Nordic Innovation, a subgroup of the Nordic Council of Ministers. And we started out together with ORCHA, build what we could call a Nordic accreditation platform. We have based it on international framework and standards because it's not that many ways to do this, so we can base it on already experience out there. Then we wanted to add Nordic specific requirements if there were any, but we also wanted to look into how could we already from day one build Nordic interoperability requirements into this accreditation platform so that we one day further down the line could be able to also utilize the data collected in these digital health solutions also on the preventative care side. The second part we are working on is what to do with the digital health solutions that is evaluated and found of good quality. Well, we have to make sure that they can be spread and be shared on a big enough market to give them business sustainability. So for that reason, we have now built what could be the starting point of our Nordic warehouse for quality assured solutions, so that they could have a widespread in 5 countries instead of just one region or one country. And then the part we are working on currently is how to disseminate and activate and build activation services on a national and Nordic level, so that we could get the quality assured solutions out in the hands of the right people. And this should be done by national organizations. This is not a Nordic task to do. We respect the national authorities on this, but the Nordic warehouse could be the starting point and the place where to find the quality assured solutions, so that the national organization could spread it either directly over the counter to the public, to the individuals, or through professional channels for digital medication, as it were, traditional medicine with prescriptions and all of that. So that's up to the national organizations. So currently we have built together with ORCHA the whole framework for the accreditation platform. And we are currently working with national initiatives in Sweden, Denmark, Norway, Iceland, Finland, to see how we can then get these digital health solutions out to the individuals and get the individuals involved in their own care as well. I think that was a short introduction to how we have been working in the Nordics. Thank you. Luke?
Sorry. Still need to get used to the to the webinar functionality. Okay, thank you very much, Anders. I think it was really, as far as I'm concerned, very enlightening. And wow, setting up such a ambitious collaboration framework is not a trivial issue, but it can be so powerful, so incredibly powerful. So congratulations for this initiative. I think it's really.
I think the reason behind that is really important to understand is that given that we do this on a national level, these 5 countries, as with many other countries, are quite small. And it's not just about looking at the digital health solution from a healthcare perspective, because from the healthcare perspective, we just need a good app. We also have to look at it from an industry perspective, where we have to give sufficient marketplace for these digital solutions to have a business model that gives them sustainability. And then it's not enough just to be used in a small region or at one hospital. Then it doesn't take long before they are disappeared. So we have to give them big enough marketplace to be viable. So it should be easy to be accessible across the Nordics, but it should also be a very low threshold to get into international frameworks so that it could have international spread as well.
Yeah, that's a very important message, I think, also for sharing the information between the frameworks. A very, very important point, actually, that most of the best solutions need to have a sufficient share of market. Yes. And that's not easy for some of them. They're not big companies necessarily. They need to develop translations or adaptation for specific contexts and so on. So that's a very important message, that actually this partnership also needs to be engaged from that side.
Definitely.
Thank you, Anders. So I propose to shift to a very specific use case, which is mental health in the Netherlands, with Rimert. Thank you, Rimert, to be there. So you are the CIO of the iMind platform in the Netherlands, which has also been working with ORCHA, and you're gonna explain us what you wanted to achieve and what you have achieved. So the floor is yours.
Thank you, Luke. I will tell something about the app guide. We call it the appwijzer in Dutch. And let me tell you something about how we guide people through the jungle of mental health apps. The app guide has been co-created by Mind and the Nederlandse GGZ. Both are NGOs. Mind supports former or people who are actually having mental health problems and their informal caregivers. And the Nederlandse GGZ supports professionals who treat people with mental health problems and their organizations. I would like to start with some issues first. Those have already been mentioned by Anders and Tim, but talking about health apps or mental health apps, it's a fact that they have at this moment a very low retention rate. A lot of people are downloading apps, but not a lot of people continue to use these apps. Also, the market is very volatile. Apps are coming and going, and at last, there is also low quality of information about mental health apps. So the number of health apps is growing, but also the problem is growing of actually using these apps. And that's where the App Finder comes in. If there is no sustainable use of apps, there won't the viability of the business won't be realized. So this also it depends on the accessibility and quality of the health apps themselves. But I think that's my statement, at least, that this also depends on the information that is given of these apps. And that's where our app guide comes into the picture. It helps you to search and select appropriate mental health apps. If you go to our website, then this is a look at the front page. So it helps you to search and select tools, especially for it helps you to search and select mental health apps. This is needed by care seekers and caregivers. It was subsidized by the Ministry of Health, and it was developed by learning and doing with the support of experienced clients and professionals. And since January this year, we have been visited by more than 30,000 people. If you try to search and select mental health apps in the app stores of Apple and Google, then that's quite problematic. If you search on mental health, you get a lot of apps, but some apps have nothing to do with mental health. If you search on, for instance, depression, you get also a lot of apps, but not all apps are related to depression. If you look in detail to these apps, then you will find some information, and you get also some reviews which could say something about the quality. But if you have a look at it closely, then you'll see that it's quite a lot of rubbish. So the problem using these Play Store or Apple Store is that you are very difficult to find an app, but also it's very difficult to judge about the quality. So that's the problem we try to solve with our app guide. If you search on our website on depression, then you find a lot of apps which are related to depression. And you could also search on other kind of mental health issues. More easily than you will find and select apps in the stores of Apple and Google. Then if you get the information on our website, then firstly we make use of the information of the developers of the apps themselves, but also we share information about the assessment ORCHA has been doing, and we show that information in detail if you want, but we also show people some kind of rating. The higher the rating, the better the app is. But we also give some kind of summary of what we call a preview or review of the app, which is more or less the same. Is this an app which you should, which we are recommend to use or not? We give some pluses and minuses to make that decision your own. And this is only the front end, but behind it there is a lot of organization. It's what Anders called. It's a system behind it. We make use of ORCHA, which the use we make is that they scraping and assessing the apps, and they give the apps some kind of rating. Mind, that's where I work for, does the prioritization of the apps, but we also do our own testing, and at last we do some editing and publishing of the information. And the essence of our success, I think, is the multi-layered concept of co-creation, and I will explain that more in detail. So we start with the ORCHA assessment, which is based on the NICE ESF, which Tim already explained, and it leads to 3 ratings of data and privacy, usability and accessibility, and the clinical and professional assurance. And those 3 topics are the main topics people are interested in, we know from focus groups. And also, caregivers and care seekers have the same needs in this, but professionals are more interested in clinical and professional assurance. Then, on top of that, we do some testing ourselves, and this is done by a test panel, which consists of people who are having or did have mental health problems, and also there are psychologists and psychiatrists in the test panel. So they test an app during 2 weeks, and they fill in a testing report, which is structured by qualitative and quantitative questions. So we give by this an indication of the usefulness and the amount of recommendation, but we also are looking for, is this an app which is only informative, or could this also support self-management or blended care? So this leads to another kind of ratings. And at the end we make a consolidated review of that, and that's a summary which expresses the pluses and the minuses and gives you some hints if you would like to use this app. And this way of layering of information is also what people like. They would like to have one kind of rating, and knowing that rating, they would like some information about that rating. It's more or less the same if you use booking.com, but this is more based on objective testing than booking.com does, of course. So behind it, there are the assessors of ORCHA and the editors of Mind and the peer reviewers of Mind. Peer reviewers are users of apps. In the future, we would also like to add information of users who will also use the app for 2 weeks and fill in the testing report, so that we could make a larger amount of reviewers possible. This information goes into the ORCHA app library, and where the GGZ app library is part of. And this information it can be presented in the advice or the app guide. This can be a website, but it could also be a personal health environment, and we have been testing that also, and it's actually live with one personal health environment in the Netherlands. So this way you can get information in different front ends, not only one website, one platform, but it's in your smartphone in every way. Well, in the future, there are some next steps, which of course will be that we would like to have more visitors, we would like to have more apps tested, but we also are working on a multilingual version. As said, we would like to have structured reviews by users and not only by our peer reviewers. We would also like to have a functional categorization. For instance, does this app help you to concentrate or structure your day, or overcoming sleeping problems, instead of making use of the DSM classification. And also we would like to migrate to one universal standard, which I think should be based on CEN ISO. And we also are looking for structural funding, and at least at last we would also start some kind of communities of companions to support mental recovery, so that we could also work more preventative than curative. Well, as said, to get a viable business with eHealth, the use should be sustainable, and in that way you could transform your health domains. But this starts with having accessibility and quality of eHealth applications, but also it depends on the information about that accessibility and quality. And so that's why it's important that we join this kind of initiatives in the Netherlands, but also in Europe. So that's what I had in mind to share with you. So thanks for your attention.
Thank you very much. Again, a very different spotlight and very interesting. I think what we see here is that, well, to say how to deal with complexity, and a very evolving one. And that your presentation was very instrumental in showing how you've been using ORCHA in order to reduce somewhat the complexity, and then develop only at your level the approach necessary to fit the use cases you wanted to develop. So I think that's what we should learn from your presentation, basically, is that there is a work which needs to be done on different layers. Do you agree with this statement?
Yeah, I agree very much. It's just to give some example. If you would like to go to a movie, then you would like to know that nobody was misused making the movie. And you are also interested in if the music is not too loud or not it's understandable. But what you really like to know is, should I go to see this movie or not? And so you also need not only the objective information of this movie, but you would also like some kind of approved opinion of someone who has seen this movie before, and what he is finding about that movie. And the same is more or less going or using apps. So you will need some objective information, of course, especially when you're a professional and you would like to give advice about that app. But still you need some kind of review about should I use this app or not.
Thank you very much. I'll give back quickly the floor to Tim, because he still needs to explain us what ORCHA has been doing with Israel. And Tim, you told me in the briefing that actually that's that's probably the country which pushed you the further on the road in discussing what needs to be done, and with the kind of support which needs to be done to support assessment frameworks, right?
Yeah, no, I mean, well, that's.
You might reshare your slides, huh?
I'm not going to share the slides because I think given the time available, I can much more easily summarise it. But yeah, I mean, I think each of the projects we've worked on, whether it's with Rimit, with Anders, the Israeli guys in New Zealand, Canada, the US, they've all added a huge amount, and it's been amazing to see how each of those has sort of incrementally moved things along, and then that's been shared across. So I think what Rimit's described there in terms of the test panel, actually realistically is probably one of the only meaningful approaches currently to getting true user experience information into the process. And so that's now being discussed to be adopted in other frameworks around the world. In Israel, the issue that they really started with was how do they make sure more digital health products go to Israel and want to target Israel and become something that make it a focus. So they were really coming at it from a perspective of ensuring that they could create a model that both assured them of the products that were going into the Israeli market, but also encouraged products into the Israeli market. So they were really very conscious of the balance to be struck between not going overboard on the rigor side and actually making the assessment so difficult that it would have the opposite effect and put people off. So they wanted to create an incentive to increase the number of products, not just the number of products available in Israel, but the number of products targeting and specifically tailored to the Israeli market, and notably those that are available in Hebrew, because there was a tiny, very small number of products that had actually been made available in Hebrew or Arabic for that matter. So the process we went through with them, which is common to all of those different projects I've described, was a process of going through each of those what we call the assessment domains, looking at the detail of those domains and starting to tease out which ones were going to be suitable for Israel. And that's essentially a kind of iterative process. The first pass, these are all things that are perfectly transferable into the Israeli system, and there was no issue with that. We do the same. We've done the same with Anders in the Nordics, and we're doing the same in Finland, etc. And then the second layer of that assessment is which elements need to be tailored to the specifics of that country. And that might be jurisdictional, regulation type stuff. So it might be there's some specific regulations. So in New Zealand, a huge amount of focus was around the treaty, with the Maori Treaty in New Zealand, which really focused on making sure that those elements have been factored into the process. In other areas, obviously in the US, we're factoring in different kinds of regulations, but in the process is always the same. What can we adopt that is broadly being adopted everywhere else? And as I say, the ISO is a great anchor point for that. And then what do we need to do to change that specifically to our territory? And that combination of adopt as much as you can, but have the flexibility to do your own thing for your own specific requirements is really crucial, because it means that you're not just trying to force one standard, which will make it very difficult for in the Israeli context. They needed to be able to adjust things for their particular use case. So what they've ended up doing in Israel actually, which is similar in concept to what you've seen already described by Anders and Rimit, is that there is what they call the IBR layer, which is the Israeli baseline review layer, which includes data, professional assurance, usability and accessibility. And then they built an Israeli enhanced review layer, and they've specifically focused those on the more significant, more complex and risky apps, the apps that in the NICE evidence standard framework would be described as tier 3A or 3B. And for that review layer, they've added an Israeli clinical assessment, which is something that is also actually quite popular in all of the other projects, an Israeli enhanced data assessment and an Israeli enhanced usability and accessibility assessment. So that's how they've ended up constructing the model there. But again, I'd say 80% of what's in there is very consistent with everything else. It's just that additional 20% that's unique for them. Luke, can't hear you.
Yes, sorry. I've managed finally. Yes, just maybe before giving the floor for a few minutes, for the few minutes there to everybody. One of the questions in the chat was indeed related to with this new standard now being majored and hopefully coming live in the coming months or so, and so on. How would you see the interaction of a framework like ORCHA with such a standard? What could be the win-win mechanism?
Yeah, so we've already been gearing up for the ISO, becoming live. So we built all of the ISO components into our systems, and they are all presented to and made available to all of our national accreditation clients as options to incorporate into their accreditation processes. We make a very clear sort of distinct. Well, we make it very clear when we're building those accreditations where they're varying from that ISO, so that we can make it so they are making informed decisions to vary from it, as opposed to doing it by accident. And we're going to provide, at a developer level or a product owner level, ISO certifications to allow them to be able to establish that they've met that standard. So we see the ISO being hugely valuable in terms of the label that's been developed, from a public awareness perspective. That will increase, I think, the trust side for people who are accessing products directly themselves. It will be helpful, I think, for healthcare professionals, but I think it will need to be incorporated into accreditation processes to really solve that part of the problem. But I think the accreditation processes themselves will benefit from the fact that the ISO is really creating this consensus that they can start to draw upon. I think over time that will grow and grow and grow, but at the minute we don't have to wait for everybody to have exactly the same view, as long as they're all moving in the same direction.
Thank you, Tim. Maybe comments from the other speakers on that point? Maybe from Hani. Hani, do you have any opinion?
Yeah. No, I think it's clear that, from the previous experiences that we saw, I like this 80-20% ratio. Like, if you can easily build your 80% based on existing standards, based on, the minimum consensus that exists already, this will accelerate significantly. And then you can add your 20%, when it comes to your specific use cases or your specific, context, etc. And this is very critical because, there was a very interesting question at the beginning of the discussion. Why it seems that the assessment framework were only focused in Western Europe, and maybe because of the maturity, indeed, maybe because those were the front runners. That after a while you discover that you absolutely need to have those types of assessment frameworks. So the assumption is all the remaining part of Europe, all the remaining part of the world will be in this situation sooner or later. So the more we can have those types of assets, standards, frameworks available, this will accelerate the process. But also, it's not only about the existing of a framework, it's how you integrate this assessment framework into an accreditation process. And this is a whole governance issues, a whole kind of system that needs to be in place. And I think I really like also points Andres mentioned, that we should look at this from an ecosystem perspective, that it's not only for the clinical health outcomes, but also for the benefits of the providers and the developers to have, what many people call the single digital market. Actually, instead of having, one little country or two countries, you kind of expand your market, and this creates much more sustainability opportunities, and you can scale up, and you can afford actually to cover and cover the cost of being able to go through those assessments, because there is a cost associated, to be, certified. So I think it's all things that are really nicely coming together in this, and I think the experience from Andres, from Remit, and from Israel will be significantly useful for other countries. And this is one of the hub objectives and missions, is really try to make those experiences well known, and really to provide those as lessons learned to be consumed by the other members of Europe and globally. So again, thank you very much. I think that was a very useful from a hub perspective as a knowledge sharing platform. Thank you.
Thank you very much. Any final word from you, Anders or Rimert, before we close?
Yeah, I just want to say that in all the work that we are doing, we are trying to stress kind of the sense of urgency in all of this, because we could spend the next 5-10 years discussing how to evaluate digital health solutions. But in the Nordics, at least, currently, we are not giving the individuals or the healthcare workers any guidance at all. So anything is better than nothing. So my kind of message is to just, there's a lot of good frameworks out there. There's a lot of good experience out there. We have to get started. We have to get the practical kind of relevance into this and just get quality assured solutions evaluated, but also put in the hands of the right people, because the stress on the healthcare system is too big. So we have to lift the focus away from just how to evaluate, but also have the focus on how to activate digital health solutions, because that's where the value is actually coming to the society.
Yeah, thank you very much, Anders. Rimert, your final word?
Oh, thank you. I agree very much with Anders. I think doing is the best way of learning and evaluating the next steps. So, and because it's a volatile market, we need some kind of stability in guiding that market to the next steps. And that's what we are doing, I think. So it's great that the mHealth Hub supports this movement. So thank you very much for inviting us.
No, it's me who wants to thank you very, very much for your time, both for today and for the preparation and the discussion, and especially, of course, special thanks to ORCHA, with whom we had a few meetings already to discuss how could we actually use the added value present in ORCHA and the mHealth Hub together. So hopefully we will try to see how we can further work together in the future. So thank you very much. I wish you a very good afternoon, and probably for a good lunch for some of you, depending on time frame. And so the presentations and the video will be available. So for the people who could not make it today because they were on holiday, they will have a good surprise when they come back. Thank you very much. Ciao, ciao.
Thank you. Thank you. Bye-bye.
Bye-bye.